Hi, Dr. Slavin, and welcome viewers. You're listening and watching healthcarehoaxvideos.com. I'm Janet Cimorelli. I'm talking with Dr. Herb Slavin. And Dr. Slavin, you have a very interesting trip coming up this week.
Yes, twice a year, A4m, the American Academy of Anti-Aging Medicine, has a conference, and this is their winter or fall conference. It's in Las Vegas, and this is where I learn about all the things that you will never find at a mainstream medicine conference. This is where they talk about low-dose naltrexone, or chelation therapy, or IV vitamin C, or ultraviolet blood treatment. You know,
What about some of the tests that you do at the Institute of Advanced Medicine? Do they share information about the latest techniques for uncovering causes for illness?
Yes, also some diagnostic tests that we use here, for example, heart rate variability and looking at the autonomic nervous system, very important way to identify people. In other words, you could think you're healthy, but the autonomic nervous system might tell you otherwise. Another very important one is thermography, very important tool for identifying women when you do breast thermography at risk of developing breast cancer. Wouldn't that be nice to know in advance that you're at risk so you can make the changes so you don't get breast cancer, instead of going for your yearly mammogram just looking for breast cancer? Doesn't make any sense to me.
So the thermography, and you have the thermography technology available for testing at the Institute of Advanced Medicine. So women could have a thermography. There's no radiation, there is no compression, and you're not necessarily looking for an identifiable lump or mass. You're looking for the developmental process.
As the name implies, it measures temperatures. And in a healthy person, the temperatures in the breast are symmetrical and cool. But when you see hot spots, you know there's something abnormal going on. And if it's severe enough, we refer the patients for an MRI of the breast or an ultrasound, never a mammogram. And it's just a very useful tool because most of the time you're going to pick up abnormalities that will not be seen with any other technology. Won't be seen on MRI, won't be seen on a mammogram or an ultrasound because it's a functional abnormality, usually brought on by a hormonal imbalance. So that's the usefulness of thermography. And when you correct that imbalance, then things improve, and that's one of the ways you can reduce the risk of developing breast cancer.
Okay, so if someone is at risk for developing breast cancer, they can monitor how dangerous their situation might be. And when you evaluate someone, one of the approaches would be to modify the ratios of different hormones. Is that correct?
Yes, well that would be the first step because that's what you usually find is a hormonal imbalance. So you correct that. There are some tests that are fairly new that can tell us whether that person from a genetic standpoint might be at increased risk for breast cancer. And in those patients, this is where, for example, I would recommend low-dose naltrexone. If someone has that increased risk, you would do that.
Okay, and is there any nutrient evaluation? And of course, I'm coming from my perspective as a nutrition counselor. Do you evaluate certain nutrient status markers that would give you some information about where their immune function or where their body's ability would be to respond to abnormal cell changes?
And I'm going to tell you the common nutrient deficiencies we see: low vitamin D, low CoQ10, low omega-3s.
I have a question. What about CoQ10? Is that one that you
Did I say
sometimes?
CoQ10?
No,
Oh, that was the fourth one.
okay,
Yeah,
all right.
CoQ10 also very low.
okay.
So imagine what effect or benefit there would be if you corrected all these nutrient deficiencies. It would enhance the body's ability to stay healthy.
Now, with so many of the things that I've read about, omega-3, omega-6, omega-9, people need to be aware of what that omega status is. And what I've read is that so many times omega-6 is out of range, very high, and low omega-3. Omega-6s have a hormonal impact, and I'm thinking of things like flax oil, borage oil, evening primrose, blackcurrant seeds. So those are omega-6s. Do you work with establishing the correct omega foundation?
There are tests to look at the breakdown of your omega-3, 6, and 9. But clearly our diets are very high in omega-6s. And therefore relatively low in omega-3s. Ideally, the ratio to omega-3 and omega-6 should be 1-to-1. And I think in our diets, it could be, 20-to-1?
Right,
Something like that?
it's
In
terribly
favor of
off-balanced.
omega-6. That's
Yeah.
the problem. Now, you probably could correct that to a large extent if you went on a paleo diet. Would you
Okay.
say?
Certainly, I think that the idea of a paleo diet, Dr. Slavin, sometimes is intimidating to people who are relatively new to the concept of natural support to good health and functional medicine. So that isn't where I jump in right away, but I think it's so important for them to be testing all of these things.
I have to say, one of the most important tests I do in the office is a body composition analysis. And very few people are where they should be when it comes to their body composition. Usually we're finding too much fat, not enough muscle. And that's up to the individual to improve. But mainstream medicine ignores that entirely. All the problems that are brought on by having the improper body composition can be reversed, but not with drugs. You have to reverse it on your own.
It's interesting because there's a little bit of help. On Healthcare Hoax videos, we did a segment on LDN, low dose naltrexone. And low dose naltrexone is going to help to modify too high an insulin level, and then you have a better potential for moving toward the proper body composition, correct?
Yeah, and I'm in favor of anything that can help improve the person's overall health, because you don't do that with drugs. You mask things with drugs. You don't improve things.
Okay, so there's a global epidemic with diabetes. There's so many autoimmune issues, so many diverse health challenges, and when you join us on healthcarehoaxvideos.com, you'll be right there at the source of the discussion about how to manage your good health. I hope you tune in again soon. Thanks for watching.